talk. There's 4 of us. We're all from Dr. Malat's lab at WMU. And so today we're going to be talking primarily about teaching the kids who don't always do very well in early intervention settings and trying to modify our instruction to help them do better. So I'm Joseph Shane, and I'm going to do the intro, and then I'll go into my little portion, and then we'll all come up and do our individual sections. So let me give you a little background on how we ended up doing this type of research in the first place. As I mentioned before, we're all at WMU under Dick Malat, and that's the behavior analysis training system. Probably half the audience is composed of people in the behavior analysis training system, but that's okay. So this will be reviewed to some of you, hopefully. That I've already mentioned. And what you'll probably notice in the presentation today is that although we're attempting to do good, solid research, we also have a very heavy practitioner focus for our interventions. So we're trying never to sacrifice the potential progress of the child just to make the research a little more sound. We're more on the side of what can we do to ultimately help the kids as much as possible. And so at the MA level, it's a very heavy practitioner focus. At the doctoral level, which all the presenters today are, it's research still within that practitioner orientation. And we do research at a couple different practicum sites in Kalamazoo, including Woods Edge Learning Center, which is where all the research today was conducted, and the Kalamazoo Autism Center as well. So if you're ever in Kalamazoo, feel free to get a tour at either of those wonderful locations. So a little bit about our classroom at Woods Edge. So it's an early childhood special education classroom where we conduct our research, and we provide staffing for that room as well. So it's kind of a unique situation where children are coming in from the surrounding school districts, and in the discrete trial classroom, it's staffed by undergraduate students and graduate students from WMU, as well as employees of the Educational Service Agency. And we focus primarily on doing one-on-one instruction with the kids as intensively as possible, and typically that involves discrete trials. And we focus on primarily skill acquisition, so we get kids, the youngest we typically get them is about 2 years old, and they can stay in our classroom until they turn 6, and then they have to transition on to another setting. And typically we're trying to move them out before that, especially if they're doing well, they can move on to more of a group setting and progress through the school that way. So primarily focused on skill acquisition. We do a little bit with problem behavior reduction, but we have the real little guys, so hopefully we're not seeing too many of those issues anyway. And we promote daily living skills when possible. And what we're really focused on, and what kind of the emphasis will be today, is we're trying to get that learning to learn component to early intervention. Really we're focusing on establishing the important early prerequisite skills that will allow our kiddos to be effective in later learning environments. So a little background on how we ended up doing the type of research that we're doing today. What we've kind of seen in behavior analysis in general, I think, and specifically in our program as well, is that we do pretty well with the kids who do pretty well. The kids that are learning pretty easily, it goes okay when we're working with them. The kids that don't do so well, sometimes we don't do so well with. It's hard to be as effective with those kids. Excuse me. So what we find is most kids progress through our curriculum successfully, but there is a small percentage that makes little to no progress. And we did a little lit search, and we want to say, okay, is this just us? Is there something wrong that we're doing? But that's reflected in most of the longitudinal studies that are out there. So in Lovas's big one, and by Sells and Graupner, they're updated a little bit later. You see that about 50% of kids do pretty well in early intervention, and those might be the ones that are even eventually able to blend in with typically developing peers. So that's great, and as a field, we should be very happy about that. But we also see that there's kind of this lower 10% who are not making considerable or sometimes even any progress, even though they're receiving intensive early behavioral intervention, good quality services, they're still not progressing. And that's something that we should be trying to work on as well.
John.
One of the things we looked at, we tried to differentiate then, how can we identify these kids earlier on to make sure they're getting services intensely when they need them. Those of us who have been in early intervention for a while, you can kind of tell within a couple months of knowing a kid, like, okay, this kid's on the right track, they're doing pretty well, but you can also then sometimes identify, but sometimes kids fall through the cracks. So it'd be nice if we had a data-driven way to kind of determine which trajectory these kids might be on so that we can intervene in a systematic manner. So we kind of broke them apart into two groups, and this is just our terminology, and it may not be the best, but it's what we went with. So we have high trajectory learners, the kids that are doing well, and they're going to move on with little support in the future. And they're averaging, so this is going to be idiosyncratic to what your procedures, what your teaching programs look like, and how many hours a day you have the kids, and how often they're working on them. But what we found is that our kids were mastering a little over 3 skills per month. And so that's, you know, your variety of your different early intervention, VB-MAP-ish targets. And they're only in our classroom for about 11 months because they're doing pretty well, and then they move out to a less restrictive setting. We compared that with kids, so we went back and looked at, okay, so to get that group, we said, okay, here's 10 or 15 kids that we know did well, and here's how they did when they were in our classroom. We also have 10 or 15 kids that didn't do very well. Let's look at how they did in our classroom. And so you see they're mastering only a little over 1 procedure per month, so that's a big red flag. And they're spending considerably longer with us getting those one-on-one services when ideally we'd want to get them to a less restrictive setting as soon as possible. And as I mentioned, these results are idiosyncratic based on, you know, what your procedures look like, how you've broken up your task analyses and all that good stuff. So if you're going to kind of use this system in your own setting, then you should adjust it, of course. But our goal here was to help identify students who give us those red flags so that we can catch them early on, because as we all know, early intervention is important. And if the kid has been with us for 6 months and we're only just now realizing that it's not going well, then that's time that we've wasted that we could have otherwise used. So we tried to then break apart, okay, what is it about these kids? Why are they not being as successful as other kids? Or what are we doing differently with them, or what could we do differently with them? And so a variety of studies, and we have references for all these. There are too many to put on the screen, so we'll have our emails up at the end. If you want any specific references, please feel free to get in touch. Different studies have looked at, okay, what are some things that correlate with best results coming out of early intervention programs? And those are things like strong visual discrimination skills, strong auditory discrimination skills, imitative behaviors, and vocal verbal behavior are some of the variety of things that people have found positively correlate with good intervention or good outcomes from early intervention. And what we see often is that these lower trajectory students who end up needing more intensive support longer, who are not acquiring skills very rapidly in our classroom, those kids have difficulties, especially with acquiring some of these important fundamental skills. So visual discrimination tends to be one of the easier ones, even for the lower trajectory kids, but we have some that are still not even acquiring simple matching skills, for example. So one of the talks today will touch on that. So once we had kind of a feeling for, okay, what's setting these kids apart, what specific areas are they having trouble in, then we decided, well, what can we do to try and remedy that situation? And so kind of the goal of our doctoral research for the past several years then has been, let's try and break things down even further and help these kids that aren't doing so well, try and get them to do a little better. So we're focusing on child-specific skill deficits. We're trying to target areas that are going to affect multiple children and help multiple children. But we're also happy to try and just rescue one individual kid if that's what it takes. And so we're working on establishing prerequisite skills, and oftentimes that means getting really simple. So even though we think matching to sample, the standard way everyone runs it, is pretty simple, it's the simplest thing we can come up with, it turns out it's not, and you can get even more simple. But it's not simple, it's complicated to get simple, so it gets a little tricky. And so again, we're just trying to simplify, and we're intervening in an intensive manner on these specific problems that each of these kids is having to try and bump them from that lower trajectory and get them up, catching up to peers, and have better results overall. It's not easy, and we don't always succeed as much as we'd want to, but I think it's a noble goal nonetheless. So that's kind of where we came from in terms of why we started conducting some of this specific type of research. So now we will go into some of the specifics of what we've been doing. If you have any questions or comments, we should have time at the end after everyone is done presenting, so please hold your questions and comments until then. So I'm Joe, and this is the study that I did for my dissertation. And so I was worried about increasing vocal behavior, and more specifically then trying to get echoic stimulus control in our kids. So we said we're worried about the kids that aren't doing very well, the lower 10% or so. So then we started thinking about what skills would be good to intervene on, and so what about language? That's of course an area that children who typically are more autistic or are not progressing through EIBI programs, they have trouble both with expressive and receptive language skills. If we can get language, that's correlated with better treatment outcomes. Language involves and includes teaching a lot of important behavioral cusps that may help in a variety of areas. And the nice thing about language is that at least some of language is directly beneficial to the student. Now you can argue that of course imitating and being able to match and listen to people, those are all beneficial too. But of course there's something about manding that makes it much more reinforcing because you're directly affecting your environment. And so hopefully this is going to be motivating for these individuals. Now when we talk about traditional approaches to language instruction, there was, even though verbal behavior had been published before Lovas started doing all of his early work, you didn't really see its influence in a lot of the early programming. So we had a heavy receptive emphasis. Labeling was much more prominent than manding. But I'm sure they did the best they could, and it went pretty well. But more recently, with the popularity of the verbal behavior approach taking off, of course, we look at things from a slightly different, more functional perspective and focus more on things like manding and tacting and echoics, and not assuming we're going to get transferred for free and all that good stuff. So specifically, I started looking at echoic behavior because that's something that if we can get it, it's going to be very beneficial for these children in learning a variety of vocal verbal behavior. They were having trouble, oftentimes these lower trajectory kids were having trouble or didn't have echoic behavior. So why should we target echoic behavior? Well, if you can get it, it includes, echoic behavior obviously includes making auditory discriminations. And auditory discriminations are a big weakness typically for this lower trajectory path. So if we can target auditory discrimination within an echoic context, then great, that'll hit that side of things. And if we can get echoic behavior, at least emerging echoic behavior, that's going to be very helpful for teaching other verbal operands, things like mands and tecs and interverbals. It's part of, it's at least surmised to be part of other more complicated skills, joint control, and things like that. And of course, it's the foundation of basically all more advanced verbal behavior. So echoic behavior is something that in early intervention, of course, pretty much everyone is trying to teach at some point. And so the question is, how do we best teach echoic behavior? And the answer to that tends to be however the child is going to most effectively learn it. Anyone who's been in the field for a while has probably encountered several different ways you can teach echoic behavior. And so that includes things like standard vocal imitation training where we sit down with a kid who maybe already has some emerging verbal behavior, and I say ah, or I say ah, and if the kid makes an approximation, then they get the reinforcer. And so that's pretty easy, pretty straightforward, and pretty common to use. However, if the child doesn't have any of that vocal behavioral